Hello, what's going on, my people? It's your favorite physical therapist, Jared. Let me look at the camera. Jared, coming at you from Resilient Rehab and Wellness. Good afternoon, folks. I'm super excited to be here. I asked you all what you wanted on Instagram regarding the shoulder, and you said you wanted it all. So we're going to try to break this down as best we can. Today's episode, okay, for our shoulder series is initially just going over the basic anatomy. Now, before we get underway, I have a little spiel I want to give you guys because I am super excited. This is our first kind of true to form physical therapy content, I guess you could say, that we're going to be creating. So it's a learning process. It's a learning journey. I appreciate you all coming along this journey with me. And why the shoulder? Let's start there. Why not the shoulder? I love the shoulder joint. One of my favorite joints in the body is the shoulder joint. It's the joint that first exposed me to what physical therapy is. Young 15-year-old Jared playing soccer. First 5-10 seconds of the game, we steal the ball. I'm dribbling the ball up the field on the right wing, and I get slide tackled from behind. I'm going full speed. It upends me. All happens so fast. I land on my shoulder. I wish I had used my old karate skills to roll out of it. I didn't. I land and I slide on my shoulder, and immediately knew that I had fractured something because I felt it and I heard it. That's all I could say was that it's broken. It's broken with, some other choice words in there. And yeah, that is what started this physical therapy journey for me. I ended up having physical therapy, ended up having a really good physical therapy experience. And that really helped shape to, wow, I mean, however many years later, right, to where we are now. So I'll dive into those types of stories, here and there throughout this journey. But that's one of the reasons why I like the shoulder joint, right? I have an affinity for the shoulder joint. So that's what we're going to cover today. Basic anatomy. Now, here's the thing, folks. I'm trying to do what I love, which is build that bridge, okay, eliminate that gap between the information that's out there and making it relatable, digestible, right? Understandable for the common person. So what you can expect from this type of video is to do just that. Translate all the medical jargon and really provide, hopefully, some examples and some just different frameworks on how to think about the human body so that you have a better understanding of what's going on with your human body. Now, we're going to talk about the shoulder first today. We'll do a bunch of other joints in the future. We're going to do, what I think will be best for this is an inside out approach. So kind of starting at its core within the joint itself, and then kind of peel back a little bit of layers as we're chatting about the muscles and things of that nature. So we'll see how that goes. Now, this is not just for the common person who might be listening or watching this video. This is also for my fellow healthcare providers out there. All right. Shout out to healthcare providers, y'all the real ones, unsung heroes. And this is also for you all, right? My hope is that you all can take some of this information and maybe find little clinical pearls or tidbits here and there that help you better communicate with your patients and your clients and the world. So without further ado, let's get underway with our shoulder series here, going over basic anatomy. Let's get this to stage. Now, I own zero rights to these images. Okay, I do not own rights to these images. I'm not trying to act like I own rights to these images. We're just using some images that we found online to help educate. Okay, now, like I mentioned, kind of starting with inside the joint and working our way out here. What is the shoulder joint, right? A lot of you will see this described as the glenohumeral joint. What does that mean? The glenoid portion of the glenohumeral joint is the glove, right? We all know about the ball and socket joint and whether or not it fits like a glove. So we have the glove, and then what we're going to have in addition to the glove, I was hoping I could add a cursor here, but maybe not. That just looks too messy. So, and then what we have fitting inside that glove is the humeral part of it, right? Our humeral head. Okay. So the humerus is the long bone where we have our biceps and our triceps attaching to. And the head of that bone is the ball that fits into the glenoid, which is the socket. Now, what would be phenomenal? I mean, the human body can do a lot of phenomenal things. What would also be phenomenal is if it truly was this ball fitting into the glove, right? And or it fits like a glove mentality where your bones are just shaped nice and smooth, and the socket is shaped nice and smooth, and the congruency is perfect. And because of that, nothing else is needed. But that would be too easy, right? And in fact, what you can see from this image, and one of the reasons why I pulled this image is I like how it really captures what we don't realize, which is the ball portion of our ball and socket joint here is actually larger than the socket itself, right? So imagine a baseball or a softball being a little bit larger than the glove. That's exactly what you can get here. And not only because of that size differential there, but also because for all of us, our bones are not this perfect, smooth layer of tissue, right? We all have our own unique ridges, bumps, and grooves all along our joints and our bones. It's all dependent on the unique type of stresses that we put on our bodies and our day to day that do not make it a very smooth action where you could just have the two bones coming up on one another. That would not be ideal. We'd be injured, irritated, angry joints very, very quickly. Excuse me. And so as a result of that, we have a few things to help protect us. Our body has a few things to help protect us, which is phenomenal that it can do this. One of those things is you can have the lining here. You see how this kind of shiny portion of the head of the humerus? You have that lining there of tissue, of cartilage that helps protect that bone called your hyaline cartilage. And then you can get that on both ends of a lot of our joints there. Now, in addition to that hyaline cartilage, that lining that just kind of helps smooth out that part of the head of the humerus or that ball is going to be, is going to be our labrum that you don't see in this picture. Okay. But we have a labrum, which is another form of cartilage that is supposed to be a little bit of that buffer system. It's going to help provide a little bit more fluidity of movement between the ball and socket joint here of the shoulder. And it also is going to expand that socket, right? We mentioned this ball is bigger than the socket. So that would dislocate very easily if there was nothing there to help give it a little bit more surface area to connect with. And so you're going to get a labrum in there that is just like this cylindrical, type of tissue that helps, like we said, be that buffer. So it's going to help with some impact, allow for additional cushion. It's going to allow the ball and socket joint there to run along one another a lot smoother. And then it's actually going to expand the joint. It's going to create a larger surface area so that your ball is not just constantly falling out of the socket every time you move your arm. Now, one of the other things I love about this picture, and I guess any picture of the joint you would expect to show this, is that you see how much of the joint is connected to these other areas, right? Like the ball and socket joint is formed, or part of that socket, right? Your acromion, or sorry, not your acromion, your acetabulum is formed coming off of the larger bone of your scapula. And then you have your acromion that sits on top here that acts as the roof. Also coming off of, I guess the way I look at it, is coming off of the scapula, which I think is fascinating. And one of the things I try to really teach my patients is that we're not thinking of these things as individual entities. You cannot have one successful part without the other. So something you'll hear me say all the time is you can't have a healthy shoulder joint without a healthy shoulder blade. That shoulder blade that medically is called the scapula. Think of it as the shoulder blade or the wings of our back. That shoulder blade is really going to dictate what happens at this shoulder joint. And what I'll show on a later slide is how you have all these muscles, right, that attach. There's layers and layers of muscles that attach to this area. And a lot of the muscles that stabilize and attach to help move the shoulder itself, that ball, right, the humerus, moving that whole joint, that whole complex, I should say, they live on the scapula. And so if your scapula is not this strong, stable base, then the muscles that live here that then work to stabilize the ball and socket joint are going to have a much harder time doing their job because their home base is not this strong, stable base. So I give an example of jumping. Super easy. Everybody can kind of visualize that. If you're watching this, you've been sitting for a while, go on ahead, stand up, try to jump if you can. If you can't, that's okay. Visualize it and imagine jumping straight up from a nice, firm surface, wooden floor, the pavement outside, right? How easy it is to generate the force to jump. You may not get very high, but it's very easy to generate the force to try, right? Now imagine going outside, rainy Seattle weather, and it's a big pile of mushy mud out there, and you're trying to then generate that same force to jump from that mushy pile of mud. Slippery, right? You can't. It takes a lot more effort. Our coordination gets thrown off. The amount of mobility we have because we don't have great coordination and our balance is thrown off also gets limited, which then really impacts the amount of force our muscles can produce. You see this chain reaction here. It gets a lot harder. And the more times you were to do that repetitively, a higher risk of injury. So in order to have a strong, stable shoulder joint, you have to have a strong, stable shoulder blade. Now, I briefly touched on how you can see kind of the roof of that joint there being the acromion and what's called our acromioclavicular joint, which is just your collarbone, aka your clavicle, joining with your acromion there. That sits as the roof. What a lot of us have at this acromion, how it's kind of this little pointy-ish edge there, kind of which you can't really grasp from that picture. It kind of juts out a little bit, not super pointy per se, but juts out as just like extra. As it is, it's a little extra, and it's so extra that you can have 3 different types. It doesn't choose just one. It likes to have 3 different potential personalities that you might get from that acromion. You're gonna get a nice flat acromion, staying out of everybody's way. It's doing its own thing. It's just there to be an attachment point for other muscles and ligaments and tendons. You can have a slightly curved acromion. So just slightly, right? It's got a little attitude, but it's respectful, right? Still that same attachment point for everything. And then you're going to get one that's real jagged like this. That acromion is petty. That acromion likes to get in everybody's way. It's going to irritate the tissue that travels underneath it. It's going to make it harder for some of your attachment points to be able to move smoothly on and off of it. It's just frustrating. All right. So that change in that acromion level can be a reason why you get some injuries like subacromial impingement syndrome. You might see that thrown around, or just irritation to the bony landmarks themselves. I mean, there's a lot that can come on from that, right? That SAI or subacromial impingement is a popular one. Rotator cuff tendinopathy might be a little something that very popular people have heard that can come from that a little bit too. So, that's the roof of that shoulder joint though, and does need to be respected. Okay, so we've covered the ball and socket. We've covered what helps expand that space so that our arm isn't always falling out of the socket. We've talked about the roof of our shoulder. We've talked about how important this scapula or shoulder blade, aka wings of the back, is, right? And our clavicle is here doing its thing. Clavicle is a great one, great attachment point for our pec muscles there, chest muscles, and some of our neck muscles, and top of shoulder muscles. Okay. Now that we've covered that, and I apologize if that was quick. I'm excited. You can see. So if you guys have any questions, drop them in the comments. You let me know. Again, I do not own the rights to any of these pictures, okay? So we're moving one layer up from, or a couple layers up, I guess, from just the bone. Something that you can't see in this picture. I'm going to go back. I'm going to go back to slide 1 here, because something that also is not captured well, I did not grab a picture for, is, right, we mentioned how you can't just have the 2 bones there. We also have ligaments, we have tendons, we have nerves, we have our lymphatic system, we have our blood vessels, veins, and arteries that run all around and through these joints. Now, they have to be able to do so at a rate that allows for them to still have everything nice and stable. Well, how does that happen? How do all these things just be free in space, but then also remain stable? Well, they have help. They don't just do it their own. Imagine a joint that also has what I call the eggshell to it, right? Excuse me. So we have an eggshell, right? It's the capsule of the joint. It's going to help keep everything intact there. Now, that eggshell provides that extra layer of security, still allowing things to move when it's working accordingly, but it allows for everything to move with that extra sense of stability. We need as much of that stability as we can to balance all the mobility that a joint, especially a joint like your shoulder, has, where it can move in all these different planes, all these different directions, and do so very, very quickly and easily. We need some of that extra stability. So you have a capsule there that you can't see that would circumference a lot of that joint, that capsule being like an eggshell. All right. Now we mentioned, all right, this is our basic anatomy, going over some of the bones and some of the muscles. This is kind of one layer up in terms of muscles that surround and protect and utilize and create what is our shoulder complex here. So the popular ones, right, are the ones I wanted to put most attention to. We have the infamous rotator cuff muscles and tendons, right? Supraspinatus, subscapularis, teres minor, infraspinatus that you can't quite see from this image. Don't worry about all that medical jargon. Just understand that your rotator cuff muscles is just that. It's muscles. It's not one muscle. There's 4 of them. And together, those muscles work with some of our neck muscles to help create this pendulum of action to move and stabilize the shoulder and the arm as you're moving it. Now, again, we talked about how, where do these muscles live based on, where do they attach to? They live, all 4 live on the shoulder blade. Okay, I cannot emphasize that enough. They live on the shoulder blade. That's what I would consider their home base. They attach to work and stabilize and move our ball and socket joint, right? Our shoulder joint here, that glenohumeral joint. Okay, now they attach from the bone to, the muscle goes from the muscle itself to the bone, which is that humeral head, using a bridge, and that bridge being our tendons. The tendons act as the bridge from muscle to bone, and then you have your ligaments that are the bridge from bone to bone. Fun fact. Okay. Now, what I like about this image is it's not all about the rotator. The rotator cuffs get so much love and respect, as they should, because I think they're just one of the more common ones to get injured. But you got to have respect to some of these other muscles, right? We have our bicep muscles here. Biceps, bi, meaning 2. Okay. You have 2 heads of your biceps here. There's a bunch of other ones that just aren't really shown on here. We're going to get to the next slide, but just understanding some of these muscles that live in this area. The more popular ones, I should say. And then this is another layer peeled back, right? So we started inside the joint, bare bones, pun intended. We brought us a layer out. So you saw some of the deeper layer muscle tissues there, that being the rotator cuffs. Now we're one more layer removed, right? More superficial to the surface, where you get a lot of your larger muscles that work for a lot of those larger compound movements. You have these big muscles that go from the sternum attaching to the shoulder, your pec muscles, right? We have another look at our biceps, and we have muscles underneath the biceps you can't see. And then we have our traps up top here on top of the clavicle and our collarbone, your sternocleidomastoid, which is one of those bigger multi-directional neck muscles. And then the deltoid muscle that I would imagine for some of our gym goers get a lot of love, but for everyday people, I think rotator cuffs get more love than deltoids, and deltoids need to be appreciated. So shout out deltoid muscles. But you also have your deltoids here, and then they try to give some appreciation to your triceps that are going to be on the back of the arm. All right. And we have some other muscle groups in here that play vital roles, are important muscles. But we're trying our best not to get into the weeds of everything here. I just want you guys to have a general sense, a general view of what our body looks like when it comes to the shoulder complex. Okay. And that is our shoulder series, episode 1, going over the basic anatomy of the bones and the muscles. So, like I said, this is our first go at this. Feedback is warranted. Try to keep it constructive, but feedback is warranted. Let me know what you guys think in the comments. Let me know what other questions you guys have in the comments, what you can look forward to after this video. Once you get a general understanding of the anatomy, now we get to get have a little bit more fun. We get to nerd out a little bit more. And we're going to get a chance to go over the physiology. So how do all these things start to work together? Gave a couple teasers in there, but we can get into a little bit more detail. And then as we go over how these things work together, we can go over some ways that you guys can try to stay a little bit more injury free and or modify your movements if we are currently dealing with an injury. And then what I know you guys are really here for, which will come, is the exercises, right? To work on that injury prevention as well as restoration. Thank you guys very much. This is Resilient Rehab and Wellness. I do not own the rights to any of these photos, okay? I got some of these stock images just to help explain purely because my drawing would be terrible and I don't own photos like this. So I don't own any of this. Resilient Rehab and Wellness. Stay happy, stay healthy, never satisfied. Give it a like, give the page a subscribe as well, please. That would be greatly appreciated. Share this if you guys felt like this was helpful for you. More to come. I appreciate y'all. Love y'all. Cheers.